Have you been wondering how to support someone in your life with schizophrenia? Maybe you're not sure what to say or do, but your support can make a world of difference. Whether it's navigating symptoms or offering emotional help, there are ways to be there for them without feeling lost. Hi, I'm Dr. Gurvir Rai, a psychiatry resident at the Ottawa Hospital. Today, we'll talk about 4 key ways you can support a loved one with schizophrenia and when to recognize that they may need more help than you can provide. The first step in supporting someone with schizophrenia is understanding the illness and the symptoms they experience. Schizophrenia usually includes 2 types of symptoms, positive and negative. Positive symptoms are things that are added to a person's behavior. For example, they might experience hallucinations, seeing or hearing things that aren't really there, or delusions, which are fixed beliefs that don't match reality. They might believe someone is watching them or trying to harm them, even when there's no evidence of that. Sometimes they may act or say things that are completely out of their norm and don't make sense to others. On the other hand, negative symptoms are about a loss of normal behavior. They might show less emotion and be less expressive when they're talking, even about something that would usually cause a reaction. They may also speak more slowly, take longer to respond, or lose interest in activities they used to enjoy. It's not uncommon for people with schizophrenia to become socially withdrawn. By recognizing these symptoms, you can better understand your loved one's illness, which will help shape how you can best support them. Being mindful of how we communicate with our loved ones is very important. When supporting someone with schizophrenia, listening and validating their experience is essential. It's okay if you don't fully understand what they're going through. If they share a hallucination or delusion with you, resist the urge to correct them. Instead, acknowledge how they feel. For example, you might say, "That sounds scary. What can we do right now to help you feel more at ease?" Show that you're willing to listen and be there for them, even if their experience is different from yours. Sometimes they may speak slowly or take longer to express themselves. Be patient and give them the time they need. Do your best to reframe language in a positive way. Encouraging someone to stay engaged with their treatment is important, but it's crucial to do so in a way that feels supportive rather than criticizing. For instance, instead of saying, "You need to take your medications," you could ask, "Is there anything making it difficult for you to take your medications? Can I help address that?" Similarly, removing judgmental or dismissive language also creates a more supportive environment. Person-first language is an easy way of doing this. Instead of calling someone schizophrenic, you should say that they are a person with schizophrenia. Describe their symptoms as something they are experiencing rather than something that defines them. Schizophrenia can make everyday tasks feel overwhelming, and this is where your support can be invaluable. Whether it's organizing medications, driving them to appointments, or helping with daily chores, practical assistance can reduce stress and allow your loved ones to focus more on their recovery. You can ask your loved ones how their symptoms disrupt their functioning. You might come to find that specific delusions or hallucinations are linked with a place, a task, or a situation. For example, shopping for groceries might be anxiety-inducing if your loved one believes they are unsafe in public. Every person with schizophrenia has unique practical challenges. With that said, it's not only okay, but necessary to set your own boundaries so that you remain in good health. While it's important to be there for your loved ones, we need to be mindful of our own limitations. You won't always be equipped to handle everything that comes your way, and that's okay. There are times where professional help is essential. It's very important to be able to recognize the signs of a crisis. Some warning signs might include hallucinations or delusions that make them feel unsafe, severe agitation or aggression towards others, difficulties managing their basic needs such as eating or sleeping, and very importantly, self-harm or suicidal thoughts. If you notice any of these signs, seek professional help right away. This might mean contacting their healthcare provider, reaching out to emergency services, or helping them get to a hospital. It's always better to err on the side of caution if you're worried about their safety. Supporting someone with schizophrenia can be challenging, but your compassion and patience will make a big difference. If schizophrenia is affecting your loved one's daily life, professional help is key to managing symptoms. Remember, you're not alone in this. Seeking help is a sign of strength, and your support truly matters. Thank you for watching.